70094. Let's go ahead and knock out Mary Rhodes here to talk about this Roosevelt issue. Good morning, Mary.
Hi,
Welcome
Mary.
back.
Hi, good morning. Thank you.
So Sabrina's so we're talking about the Roosevelt quarantine. And Mary, I guess just with the news coming out that we're starting to see more of these sailors, at least a dozen, according to one national news story that I saw, test positive. What does that mean for quarantining on Guam? Because I thought that we had closed them out, right?
Yes, actually, 9 hotels have already completed services with the USS Roosevelt. And in order for them to leave the hotels, we actually had them test twice. If you remember, Rear Admiral Manoni, but also the Pac Fleet four-star admiral talked about having additional tests. And so there was a bit of a delay to hold on to them so we could make sure that their tests were going to indicate again after first test before they leave the hotel whether or not they're positive or negative. So we've had some interesting turnarounds in the fact that some of the sailors were asymptomatic where they stayed the entire time and still were testing positive. So those are things that they're having to been dealing with. And the hotels, when we were providing the services, they made sure every time somebody showed symptoms or tested positive that they were immediately removed to go back to Navy Base Guam.
What kind of tests were they using? Do you know? Was it the Abbott 10?
It's the swab test because I took it myself last week. And so it's the one that, it's the swab test that has to go for a couple of days for actual test results. Mine went to public health for the test results, but I do know that they're working with them locally, but also working with the test results going to another location.
So are you still in contact with the Navy with the Roosevelt? I mean, do they call you and say, "Hey, we just had a bunch of people test positive again"?
Yeah, I get the daily reports, but also I still handle all logistics with the hotels. So out of the 11 hotels, we still have 2 hotels that are currently housing sailors, and those sailors were the stay-behind team that kept watch of the Roosevelt and manned all departments so that they were continuing to maintain. So those were the last of those sailors who had initially tested negative. They stayed on the ship throughout the entire quarantine period, and now they themselves are in quarantine at 2 hotels.
So we still have sailors at quarantine hotels?
Yeah, they were intended to be what's called leave behind. So they were, I know that there have been articles out there indicating that should the Roosevelt need to leave, they are ready to leave at any moment. There will continue to be sailors either in the hotels or on Navy Base Guam who are currently waiting out their isolation because they tested positive. So they're waiting out their isolation period so that they will either be flown to the ship or back or to the carrier or back to San Diego when they're ready to travel, when they're healthy and ready to travel. So there was always a plan for that, but considering that the Roosevelt is still docked, they may indeed just continue to receive them as they're waiting to go back out on the water.
How many sailors are we talking about in to the 2 quarantine hotels, Mary?
The last 2 hotels was a little over 500.
So we still have a significant presence from the Roosevelt on island.
Yeah, that's just in the hotels. There are some currently still on base in Navy Base Guam, in isolation centers there.
So let's take us back on how all of this, happened with the quarantine facilities and the Roosevelt.
Sure. So originally, Homeland Security Advisor Tim Uggan and the Chief of Staff had contacted me with regards to needing quarantine facilities. So we sent out some emails asking all the hotels who would participate. And during that time, several hotels said no because they currently had travelers. And so there were 2 protocols, which I just resent you the protocols from GDB and GHRA. There were 2 protocols that were set, one for Manila travelers and one for non-Manila. And during that time when we're dealing with the hotels who were set aside for non-Manila, They were the ones who currently still had tourists, and they had quarantine floors. For Manila flights, we secured Wyndham and Days Inn at that time, and then we were in talks with Hotel Santa Fe. As Manila decided to close down the airport for those 3 days before they reopened it back on Saturday, that's when I heard Pacific Star was interested, and then we provided that information to Homeland Security. So Homeland Security has always been involved, but I was working mostly with Tim Uggan, not Chuck Esteves. And so whatever that means in their realm, whatever they needed to do, I know that they followed through with Hai Hoon, who's legal counsel, and he started dealing with the negotiations at that point. So really between Homeland Security as well as the other agencies that needed to get involved, I don't know if they were involved at that point with legal contracting, but at least every time we turned on a hotel, all of the agencies were involved to do their assessment, whether it's Public Health, CDC, Guam Police Department, Guam Fire, and also Homeland Security was there for every site assessment before they turned on a hotel, both for local quarantine with Government of Guam as well as the USS Roosevelt. We did not activate a hotel without a site assessment with the local government included. Their role was primarily only for the site assessment, though, so that they knew which hotels were going to be used for quarantine. Then what happened was, as soon as that point, whenever contract negotiations were taking place, that's where I was removed from the process, and I started working with the Roosevelt. The Roosevelt's a little different. They actually wanted to work with GHRA to help coordinate the whole thing because it was difficult. We had to staff up to about 5,000 hotel rooms. And initially, within a 36-hour period, I was able to get 4,000 rooms. And then we built up to the 5,000 eventually as the need was confirmed. And so we were able to get 9 hotels secured within the 36 hours. And we were able to start receiving sailors within probably even 48 hours.
And so GHRA took the lead for the TR quarantine facilities, right?
Yeah, we started facilitating and coordinating on behalf of the TR together with the U.S. Navy and Department of Defense. So the contract officer I'm working with is out of Hawaii, and they have since sent 2 individuals, one a commander in uniform who's in charge of NAFSUP. She's been on Guam for about a week and a half, and then the other person who's here now is really doing reconciliation, and so she's doing all the legwork to make sure that everything that we submitted, all of the numbers that we say from the command center, she's validating it between the medical team together with security forces, with the Marines, and then also with the hotels and the officers in charge at every hotel. So every hotel has a command center. And so all of that data needs to be verified by somebody, and that's the contract officer, to make sure that when we issue meals, as well as any amenities, that those are, or even additional rooms if they have to transfer out rooms for whatever reason, or if they have to go back on base, that all of those protocols were followed.
Hey, Mary, let me ask you. So, in the with the Roosevelt quarantine, who is performing the duties that we saw the directors and deputy directors and the Adelup staff perform at the Gov Guam quarantine and isolation facilities? So, who are your COVID,
no, at Dayton,
your quarantine
at Dayton
shepherds?
And Wyndham is always. Jason and Wyndham, those services were provided by National Guard as well as Public Health. And I know that a couple of Guam officials were there as well, together with Public Health. For the Roosevelt, we made sure that they made sure that it was actually the Marines. And then there's a command center at every hotel, and each command was adopted by a different part of the military. So, for example, there was one hotel that was specifically the HSC-25 helicopter squadron. There was one hotel that was just the EOD, the bomb disposal the group here
Got
on
it.
Guam.
Mm-hmm.
So each group manned a different hotel, and so they basically took responsibility for that. So it was an entire team approach with the military, and so they handled all services. The only thing that the corpsmen, the medical professionals, handled were the daily screenings and the medical procedures whenever they needed to get somebody some additional assistance, whether they were testing for COVID or not, even if they were asthmatic and needed to be removed and go get medical assistance. That was only the corpsmen, the medical team.
Mm-hmm.
So each time it was always security forces and a medical team.
Right. And so have the contracts been signed, or were they signed, or how does that work?
We've had iterations of that. We've had initially, when we started, in order to proceed with services, I always received a verbal authorization with a follow-up email authorizing certain amount of dollars to be spent with allocation of people. So let's say, for example, 400 sailors at a value of this much for the contract. So it's very clear each time we turn on a hotel, each time there was authorizations received with the dollars amount as well as the number of people with those dollars included. And then what we've been having the last 3 weeks is it's called a letter contract. And the letter contract basically starts putting everything on paper because we had been going back and forth on our actual contract. And so as we're validating the information to get to a definitized contract, we at least have had a letter contract in place, which is still binding, and it's a lease agreement on terms and the number of people and up to a certain amount, authorization amount, because the government has to identify the funds before they could spend it and then authorize the funds as we continue to add more people. But also there were many times when the dates were pushed to the right, and so we added more time in quarantine. So I know, again, you were aware that the decision was made where they went from a 14-day quarantine to 17 days and then to 21 days.
And how much did they pay for each room, and was it similar to the government of Guam's where it was $100 per day, and regardless if the rooms were filled or not?
No, they're based on federal per diem rates is how we came up with the rates. It's the same as what we initially proposed to the government of Guam. These rates are approved by Congress, and it's what anyone would spend if you're a military or Department of Defense or even a government official when you stay in a lodging service, whether it's on Navy Base Guam or in a hotel. There are government rates. And so we worked with government rates because we knew it was going to be paid for by the government. And so I can't disclose those rates. It's based on a package where it's all inclusive to that one rate. Includes the rooms, the meals 3 times a day, as well as the laundry, linens, incidentals like Wi-Fi, things like that. But our premise was really using federal rates, so that way it's acceptable by the federal government.
I see.
Mary, we were talking briefly before. Are we good on the Roosevelt? Or?
Yeah, the Roosevelt, we, again, we're going through that process, and every time a hotel is closed down, it is closed for at least 7 days because that's CDC's guidelines.
Right.
Both Guam's contract with the local government as well as the federal contract, we did ask for certain days of closure to ensure that the virus is just killed by leaving it alone. But we've done more than that, where the rooms have been closed for at least 7 days, and then during the additional 7 days for a 14-day period, they go through a sanitization process, but even more so a disinfection and decontamination process.
Wow.
So they're kind of doing additional steps to make sure that the areas are secured and really cleaned. Because we're not cleaning just a facility for turnover to people later on. We have to be able to clearly explain and represent that we went above and beyond what CDC or even WHO promotes on how to clean facilities, especially lodging services, because we have to repackage this and sell it in the future, and we want to make sure that these hotels are going through all the necessary due diligence with regards to cleaning. All red rooms, any positive rooms, we're actually one of the things we were able to get approved was
Is that
not
what you guys
just
call it, Red Room?
Yeah, we called them red rooms.
That's the code
that was
word,
actually
right?
The military term. Yeah, the military
Red
term.
room,
is
red room.
green,
Reminds me of The
yellow
Shining.
room for
Right?
quarantine, and then I know, right? Yellow room for quarantine. But anytime anyone had tested positive or left for medical reasons, we mark it off, and they were double secured so nobody re-enters. And in addition to decontamination, we got authorization for biohazard removal. So what that means is whether or not there was visible biohazard like blood or anything, it doesn't matter. We took the extra steps, and the military agreed to dispose of all of the soft goods. So, for example, all the linens, the towels, the pillows, those will be incinerated, and so we are actually replacing with new materials in the room.
When you say we, is this the GHRA, is it the government, or is it the military?
The government has agreed through U.S. Navy. The one who's paying for this is actually the Roosevelt through the U.S. Navy. Yeah, this is not paid for by one of the regular funds through Joint Region Marianas. We've actually had to go through the authorization with U.S. Navy and U.S. Department of Defense as a special fund through for the TR Roosevelt. So it's the Roosevelt is actually the one who's authorizing all the funds with the contract officer based on need and requirements. And so we're very grateful that they've agreed to work with us on the biohazard and decontamination and cooperate in doing more than what's necessary, medically necessary, to make everybody at least understand the process, but also reassured that we went, 2-3 times as much to make sure that these rooms can go back to the market and for our leisure travelers, and make them reassured that also the items that were in the room were actually disposed of and incinerated as biowaste.
How many red rooms are we talking about, Mary?
We've had over 500 so far. I know that those numbers were given out by Joint Region Mariana.
Right.
And so we've had over 500. And so when you're talking 11 hotels so far, right, we still have 2 hotels that are still active. But I think what's really important is that there were protocols in place, and, how people got infected during this process is yet to be seen. I think there's some questions in different that they're looking at of how this still happened, even though they've been in quarantine. But our role is to make sure that when there is a question, that they are brought back to Navy Base Guam and they get the medical attention they need. But then the hotels, those rooms are closed, not to expose anyone further. And then we handle it a different way once the hotel completely is closed down. Right, decontamination.
These 500 red rooms, can you provide a breakdown of how many in each hotel were red rooms?
I can't disclose that. I think that's, even us, we don't even have the full, I don't even have the information as far as I have the information as far as how many hotels and which ones, but because of HIPAA, I was not able to receive specific data. Right. So even that and how they're treating it is still, they're making sure that we get the support we need to clean and secure the rooms and to clear it and properly disinfect it and decontaminate it. But I didn't get any personal data as far as who was in there and why. Right. We don't even have a reason why. We just know this is how many rooms were closed. Right.
Mary, let me ask you. So I know you get the daily briefing, and you're finding out that these sailors who are testing positive after they've been released, what are they saying about it though? Is it that the first times they were tested, it wasn't read right, or are they coming into contact with other people? How are they testing positive? Do you have any info on that?
Our briefings are specific to the mission of task force, which is what they call it, the task force TR. And so we get information related to the sailors inside the hotel. We don't get information on sailors inside the fence or on the Roosevelt. So our mission and our directive is really for those that we're currently providing service services for inside the hotels only.
Hey, and then on a different note, with the quarantine ISO facilities that you kind of brought people together on, what was the deal with the providing of meals? Because in Bree reviewing these documents, it kind of seemed like the contracts, not contracts, had covered that the hotels would be the ones putting the meals out. So can you just maybe, I mean, don't go too deep into it, but tell us what do you know about it?
Originally, it was never intended. I know I did several interviews with you guys, or two interviews, and originally none of the hotel employees, they were only supposed to provide back at the house operations. And so we've been very clear with this. Even Linda has done some interviews on this of how it was going to be handled. And so we put out an FAQ for the mandatory quarantine by GDB and GHRA, and that was reviewed by JIC and also Public Health. And so it's been pretty clear from the beginning that the hotel employees would not come in contact with anyone in quarantine, that they only provide back of the house support. So I'm surprised that contract language was in there, or it might have changed, because that's the reason why you've had all these individuals in the hotels serving food, and serving linens. And so just again, to clarify, Days Inn, Wyndham, and Santa Fe all had public health, and also I believe they even had DOE nurses come and assist during this time. So regardless, they were medical related staff, maybe not medical professionals, but all medically related staff assisting, and National Guard and Police Department were at those other facilities as well.
Well, Mary, if you require any additional personnel here, as we're now releasing these directors, deputies, and the other out-of-loop staffers, they do have experience in quarantine shepherding and quarantine soldiering. So
yeah, thank you. I'd like to just kind of stick with what we have. It's been working.
All right, Mary. Just checking. Hey.
Yeah.
All right. Thanks, Mary.
Thank you so much, Mary.
Right.
Always a pleasure.
Thanks, you guys.
Okay. Take care.
Have a great week.
Okay.
Bye.
Wash your hands.
I will.
Okay. Bye. What? I'm just saying, I mean, I feel bad for these guys. Not that what they did, because they were more than well compensated. I mean, beyond well compensated, over compensated, maybe.
Yeah. This Packstar contract was one of the unsigned ones. But
Yeah. So Mary got nothing to do with the Packstar guys.
Yeah.
She's like, I ain't got nothing to do with that. I don't care how many times they say GHRA. We're not involved, not involved. But I feel bad for these deputies and these directors going back to work, because no one's going to want to deal with them, because they're going to be like, oh, you could be contaminated. I wonder, were they tested when on the exit out process?
Good question.
Thank you. 7:38. Let's go back to the phones. We have Jesse. Sorry about that, Jesse. I know you called before Mary got on, but Mary's a little bit long-winded, and plus,
Oh, yeah.
Bree,
I understand that.
when Bree goes into quarantine,